Welcome to Alcohol and Other Drugs at Work, What Employees Should Know. This program will increase your awareness about alcohol and other drugs of abuse, the effect these substances have on the workplace, employee well-being, and workplace productivity. You will be provided with information about the diseases of alcoholism and drug addiction. You will learn about the common myths and misconceptions about alcohol, drug use, and addiction. You will come to understand loss of control, how denial works, and how to not enable a friend or loved one. You will also see pictures of legal and illegal drugs of abuse, along with the signs and symptoms of their abuse. If you have any questions after viewing this program, be sure to speak with someone from your Employee Assistance Program, a human resource specialist, or another professional assigned to manage your organization's drug-free workplace policy. Enjoy the program. Take a quiz. True or false? Number 1. Alcohol and drug addictions are mostly caused by psychological or emotional problems. The answer is false. The behavior of a person with addiction leads many people to conclude that the illness is psychological. However, research has led us to recognize that the illness comes first and behavior problems then follow, not the other way around. Number 2. Valium is a common anti-anxiety drug with effects on the body similar to the effects of alcohol. The answer is true. Valium is a minor tranquilizer, and it mimics alcohol's effects on the body. Withdrawals from this drug are extremely dangerous and should be medically managed by a doctor. Xanax is also a commonly prescribed and abused minor tranquilizer. Number 3. The productivity loss to business and industry from workplace alcohol abuse is more than $100 billion. The answer is true. The federal government estimates the cost of workplace substance abuse to be more than $120 billion. This figure includes losses from increased absenteeism, accidents, injuries, lost productivity, employee turnover, workers' compensation payments to injured persons, property damage, theft, and more. Number 4. A person with an alcohol or drug problem has to want help before they can be helped. The answer is false. One of society's greatest misconceptions about addiction is that people must want help before they can be helped. Most people who enter treatment do so under the pressure of family members or friends who play a crucial role, frequently following a disturbing incident related to the addiction problem. After admission, the addict self-diagnoses his or her condition, and then the desire for abstinence and sobriety will follow. Number 5. A drug addict or alcoholic could appear as popular, well-respected, and high-paid even in late-stage addiction. The answer is true. Tolerance to drug or alcohol use in the early stages of illness, combined with a history of workplace success, along with myths and misconceptions about the disease, may help an addict appear without problems to those around him or her. The disease exists, but it may not include behaviors others consider workplace symptoms. This contributes to the ease at which coworkers practice enabling. Number 6. A person with an alcohol or drug addiction usually experiences problems at work before the family is affected. The answer is false. Home life or relationships are typically affected first. The economic incentive to maintain control over symptoms of a drug or alcohol problem is very great. The consequences of problems at work are far greater than at home. Indeed, experience shows that fear of job loss is the most powerful lever for influencing entry into treatment, even more so than the threat of divorce. Number 7. Marijuana is not an addictive drug. The answer is false. Marijuana is addictive, as evidenced by withdrawal symptoms and the need for the marijuana addict to use more over time in order to obtain the desired effect. Many marijuana addicts have a family history of alcoholism or other drug addiction. Number 8. Addiction can be prevented and cured by willpower. The answer is false. Addiction is a chronic disease. which means once it is acquired, it cannot be cured. Instead, the illness is managed. Management of addictive disease means participating in a personal program of recovery that omits all forms of alcohol or drug use. Prevention is possible through abstinence, but prevention by practicing controlled drinking has not been shown to be of practical value. Number 9. The earliest stages of addiction to drugs or alcohol may include symptoms that are hard to spot. For example, the ability to consume large quantities of a substance without noticeable effects or increasing tolerance. The answer is true. Tolerance, which is the ability to use a drug or drink in larger quantities without demonstrating typical effects of feeling or acting drunk, demonstrates the possible adaptive stages of addiction. Those who will have the greatest problems with addiction later may demonstrate the fewest effects in the beginning. This contributes to denial, making it difficult for the addict to admit he or she needs treatment. Workplace facts. Employees usually enter treatment with proper constructive confrontation. The job is the most powerful lever for helping an alcoholic or addict get well. Workplace symptoms of alcoholism may not appear for 15 years or more. Other drugs are much faster. 1 in 10 workers came to work at least once in the past 12 months with a hangover. Employees who work evening or night shift are most likely to drink before coming to work. Success rates for treated employees are very high with good follow-up. Research demonstrates success rates as high as 60 to 80%. The advantage is follow-up help and support available from programs like EAPs supported by the employer. There is no predicting who will become alcoholic or drug addicted, but having a parent with a substance abuse problem increases the likelihood by 3 times. 2 parents is 5 times the likelihood. Believing your risk for addiction is lower because your parents never drank or were teetotalers is based upon the mistaken belief that addiction is learned. If a family history of alcohol addictions or problems exist, one's personal risk is increased. The words alcoholism, drug addiction, addictive disease, and chemical dependency are often used interchangeably. Alcoholism was declared a disease in 1957 by the American Medical Association, and it was declared a disease in 1956 by the World Health Organization. Its cause results from the body's reaction to the drug or alcohol consumed. This reaction, the ability to acquire addiction, has been shown to run in families and is now believed to be genetically determined. Addiction is not learned behavior. Instead, susceptibility to addiction leads to addiction and results from normal social drinking by a person with this vulnerability. This vulnerability is believed to be inherited in most cases. The environment, culture, or psychological factors can affect drinking and drug use patterns. 70% of the average workforce drinks beverage alcohol. This is a conservative estimate. 10% of these drinkers will acquire alcoholism at some point in their lives. Drugs of abuse include alcohol, depressants, amphetamines and stimulants, narcotics and designer drugs, hallucinogens and inhalants. The cost of workplace drug and alcohol use is believed to be over $100 to $120 billion, according to the National Institute on Alcohol Abuse and Alcoholism. Beverage alcohol is ethanol or ethyl alcohol and is found in beverages, foods and food preparations, and many medicinal products. Alcohol is a central nervous system depressant, although some drinkers experience a stimulant effect from it. Employees with alcohol problems use 3 times as much sick leave and have workers' compensation costs that are 5 times higher than employees without alcoholism. Alcoholism and drug addiction contribute to lower productivity, lower morale, increased insurance costs, and fringe benefits use and abuse.